So initially when we started med school, we were thrown right into our first case, which was a sickle cell anemia case. And it was really interesting to us because this was our first time dealing with standardized patients and actual patient care. And we enter into this room and we're presented with a mother who had adopted a child from Africa, and she was concerned because the baby wouldn't stop crying, as well as she was seeing color changes in the baby's hands. Really what I think was important about these types of cases was coming back to the studios and being able to talk and discuss what we thought the case was, what the diagnosis was. And I think an important tool to this was the use of a program which let us decide what exams and what tests we would like to run. And this can be everything from really broad blood tests, running the complete blood counts, all the way to more diagnostic, looking for specific sickle cell anemia proteins and cells. And I think that every time we got a new step, we were given a response, just like in the clinic you would be when you got back an exam. And then we used, through intergroup communication, what our next step should be. And I think that this type of case is really paramount to learning how to handle situations in the clinic, especially when it comes to what tests are necessary. And this kind of weighs on the financial burden versus on the validity and necessity to diagnosing the patient correctly. So the group is 6 people, and you sit in this oval-shaped table with 2 TVs. And so we would be running on one computer, like looking up on Google. I know that sounds funny, but in reality, Google is a great resource to figuring out, especially on tests that we're not familiar with yet. And so we had to use a lot of our own initiative to figure out what would be the best next step. And as a group, right, we're in these groups every day for most of the day. So we evolve knowing how each other thinks and really build a teamwork-based, I almost would say teamwork-based curriculum, just using these groups and this type of case-based work. For me personally, and I speak on a personal note, I need hands-on material, right? It's difficult for me to sit through an hour lecture and not start to daze out after 45 minutes of being thrown information about a disease or a symptomology or a class of some sort. Lecturing cases have a time for their own. However, I think when it comes to lecture, right, the problem is you're given all this information, right? This could be a 1-hour lecture, it can be a 3-hour lecture, and you are just thrown information. But when you're sitting in a case, right, you're taking all that information, right, some of it being new, some of it we might have already known, and being able to really incorporate it into how we understand the processes behind this disease, treatment, diagnosis, the symptomology. And I think it really plays on becoming a better clinician, even from the get-go of our clerkship years, our 3rd year.